Good afternoon, everyone, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. Today, we'll be talking about COVID-19 boosters, including the newly approved second booster. Everyone will be on mute, but if you have any questions, please enter them into the chat and we will address them at the end of the webinar. We encourage you to join us every Tuesday at 2 p.m. for more webinars in this series. Next week, we will be talking about event level reporting in NHSN. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I would like to introduce our guest today, Shirley Sullivan. Shirley has been a nurse for 25 years. For 12 of those years, she has been here at Quality Insights working on quality improvement. And she currently works as a quality improvement specialist with our QIN-QIO nursing home project. So welcome, Shirley, and thank you for joining us today to talk about boosters.
Thank you. It's good to be here.
All right, so to get started, who should get the COVID-19 vaccines and the first booster?
Well, at this time, there are currently 3 vaccines authorized or approved for use for COVID in the United States. And these include Pfizer and Moderna, which are the mRNA vaccines. They are the preferred vaccines and have full FDA approval. The third option is Johnson & Johnson Janssen, also known as J&J Janssen vaccine, which is authorized under the emergency use authorization. Now, all 3 vaccines are options for both the primary and the initial booster dose. Now, the primary series for the COVID vaccine is recommended by the CDC for everyone over the age of 5 and older. And the booster dose is recommended for everyone over the age of 12 and older. Now, COVID-19 vaccines have shown to be effective at protecting people from getting seriously ill, being hospitalized, and even dying, especially people who had the booster. And we know that our older adults are at the highest risk of getting very sick from COVID. More than 81% of COVID deaths occur in people over the age of 65. And additionally, a person's risk of severe illness increases when the number of underlying medical conditions they have also increases. And this highlights that our nursing home population are among the most vulnerable to severe COVID illness. And in addition to getting the residents vaccinated to further protect them, we also want to focus on increasing the vaccination rate for our nursing home staff as well. And so therefore, we really want to encourage both residents and the staff to receive the booster for the best protection for this vulnerable population. And, at this time, we know that the staff has been mandated to get the primary vaccine series, but the booster hasn't been mandated. And there are some staff that are reluctant to get the booster. So we really just want to continue to educate the staff on the benefits of getting the booster, that will not only give them the added immunity, but will also help protect the residents they care for who are most at risk for severe illness.
So Shirley, the FDA recently authorized second booster shots under some circumstances, and then the CDC also updated its guidance. Can you give us a summary of that new guidance?
Yeah, so on March 30th, the CDC did come out with some updates of who could have received the second booster. The added guidance recommends that people aged 12 and older who are moderately or severely immunocompromised may choose to receive the second booster dose of an mRNA vaccine 4 months after their first booster dose. And then also adults 50 and older can receive a second booster, again using an mRNA vaccine at least 4 months after the first booster. And then people between the ages of 18 and 49 years of age who received the J&J vaccine for both their primary series and their booster dose, they can also receive a second booster dose using the mRNA vaccine 4 months after the first booster dose. And I think we have a link for these updated recommendations that we'll put in the chat, Kathy.
In there right now.
Okay, thank you.
Ready for the next question?
Sure.
All right, great. So if someone received a Johnson & Johnson COVID-19 vaccine and a Johnson & Johnson booster, Are additional Johnson and Johnson boosters recommended?
Well, so, people who receive the J&J vaccine for their primary series and their first booster, they can receive a second booster. However, it's recommended that the second booster be an mRNA vaccine. So it should be either Pfizer or Moderna. So it's not recommended to get a second booster of the J&J vaccine. And the reason for this is that a CDC study found that adults who receive both the J&J vaccine as their primary and their first booster, they had much lower levels of protection against COVID-associated emergency room and urgent care visits during this Omicron outbreak compared to adults who received the mRNA COVID-19 booster. So moving forward with the second booster, the recommendation is only to be given the mRNA vaccines. And to clarify, although mRNA vaccines are the preferred ones, the J&J vaccine, can be given in certain circumstances, as the primary series and the first booster. For instance, if a person is allergic to one of the ingredients in the mRNA vaccine, or they had an adverse reaction after they received one of the vaccines, or if the person just understood the risk of the J&J vaccine and booster and wanted to move forward with it, the recommendation had been, let's go ahead and give them the J&J booster vaccine rather than leave the person unvaccinated.
Okay. If someone is eligible now to receive a second booster, does that mean that they have to have the second booster to now be considered up to date on their COVID-19 vaccines?
Yeah, so no, at this time, you don't have to have a second booster to be considered, up to date. So everyone over 12 years and older who are fully vaccinated are considered up to date until the time they are eligible for the first booster. And that would be 5 months after Pfizer or Moderna, or 2 months after the J&J vaccine. So after that time period, they would need to get one booster to be considered up to date. And, a person is considered fully vaccinated 2 weeks after receiving all recommended doses in the primary series of the COVID-19 vaccination. And a person is considered up to date if they have received all recommended doses of the primary series plus one booster when eligible. So again, a second booster is not needed to be considered up to date at this time. Now, it can certainly change as more information comes out and CDC, updates their recommendations. So you want to really keep an eye out for that.
All right. So our next question is about patient consent.
Mhm.
How do you get a resident's consent for a COVID-19 vaccine if that resident is not able to ask questions or otherwise communicate with the staff?
Yeah, so, this is a good question. I know from speaking with facilities that, one of the barriers to getting the residents booster shots was hearing that, getting the signed consent from relatives or the medical proxy. So I just want, we can kind of go over what are the requirements for consent. So first of all, you need to get consent from either the resident if they're able, and if they're not able to give consent, then their medical proxy, who is often a family member. And then the consent should be documented in their chart. And then prior to getting the consent, you want to give the COVID-19 fact sheet that explains the risk and benefits of the COVID vaccination. And you really want to answer any questions that they may have. And then when you get the consent, it doesn't have to be a written consent. A written consent is not required by federal law for COVID-19 vaccination in the United States. You can either get written consent, you can get email or verbal consent from residents or their proxy prior to getting vaccinated. And then, once the resident is vaccinated, you would want to go ahead and give them an updated vaccination card or a printout that tells them, what vaccine they received or the date they received it. So if you're finding it difficult to get a written consent from family members or the medical proxy, and your policy doesn't allow for it, you might want to consider looking at changing your policy to allow for verbal or email consent to overcome this barrier. And just remember, good documentation is important. If you're given verbal consent, you want to document who gave the consent, the date and time you spoke, that you discussed the risk and benefits if they asked any questions, and that they received the fact sheet. And this is considered legal consent under federal law.
Okay. And can you talk briefly about the updates on the NHSN database reporting the new event level vaccination forms?
Yeah, so facilities should continue to submit your cumulative weekly vaccination data for your residents and staff in your weekly COVID-19 vaccination modules. And data can be reported to your modules in three ways. You can just enter the data directly into your data entry screens. You can also upload a CSV file. And then now, as of March 28th, 2022, long-term care facilities also have the option to use what's called the event level COVID-19 vaccination forms. Now, these forms are replacing the existing Excel data tracking worksheet and are really considered like an advanced version of the Excel worksheet. And and some of the advantages of using this event level form is that they're supposed to simplify your reporting of your summary data. So it's going to automatically calculate and display your weekly totals. So you'll no longer need to manually calculate and enter totals in your summary forms. It's also going to capture changes in vaccination status over time. So if you have a resident, let's say in February, who refused the vaccination, but maybe in April, now they chose to have it, it's going to show both instances on this new way of recording and uploading your data. It's also going to, for the first time, you're going to be able to record religious exemptions. Up until now, religious exemptions have been listed just under refused category. Now, it's still going to be under the refused column, but it will have like a sub column that you can pick religious exemptions. So it will help you better track your refusals, those who refuse from those who are religious exemptions. And then another benefit is that it's going to allow you to track your residents or your staff at the individual level. So you can give each person a personal identifier number. It can be a combination of any letters or numbers that you create, and then you can track that individual person on this form week after week. And if you haven't had a chance to review this new event level form, the NHSN vaccination team did host several webinars over the last couple weeks on this. And we're going to put some links in the chat for the webinar, a step-by-step guide using this new event level form, and then also a refresher training on the NHSN data system, just entering your data.
And those three links are there right now.
Thank
And
you.
And for those of you who are interested in learning more about NHSN event level reporting, that is our topic for next week. We're going to be going into detail into that. All right, so in a minute, we will start the Q&A portion of this meeting. If you have any questions, you can enter them into the chat or the Q&A box. And while we're waiting, I'd like to again remind everyone that our next webinar is on the NHSN event level reporting, and that's going to be next Wednesday at 2 p.m. And we also host office hours live chats twice a week. So if you are looking for one-on-one advice for your facility, you can pop in during our office hours and shoot us a message. And someone will be there to answer your questions. And those are every Tuesday at 8 a.m. and every Thursday at 2 p.m. And you can find the links to all of those, the live chats, the webinars, in our newsletter, which goes out each Friday. It's called the Last Minute Lowdown. And if you don't think you're on the list to get that newsletter, just drop your email in the Zoom chat and we will put you on the list. And right now, I would look to see if you have any questions. Let's see. Chat back open. All right, Shirley, here's a question.
Okay.
What conditions would be considered moderately or severely immunocompromised? And what is the COVID vaccine recommendation for them?
Yeah, so people who are immunocompromised have an weakened immune system. So they are at increased risk of severe illness and death from COVID. And, that would include conditions of like someone who was going through active cancer treatment, someone with an organ transplant, and they're taking medications that suppress their immune system. Also, if they have advanced HIV, and anyone with high dose corticosteroids that, or any drug that suppresses their immune system. So, because they have a weakened immune system, and even if they get the COVID-19 vaccine, they still might not produce enough immunity for full protection. So the recommendation is for immunocompromised people to have 3 doses of their primary series, and then to get their first booster and then an additional second booster dose. And then certainly for them, immunocompromised people, it's also recommended that they, continue to social distance, wear a mask in public, avoid crowded places, because they are certainly at very high risk for, getting severe illness.
Okay. And it looks like that's it for questions. Before I wrap up, I'd like to clarify that next week's topic for next week's webinar will be on a general overview of the NHSN reporting, not specifically just the event level reporting form. And so we encourage you and your staff to review those and join us for next week's webinar. Okay. All right. So that's it for questions. If you want to reach out to Shirley directly, you can reach her at 1-800-642-8686 and enter extension 7805. You can also email her at ssullivan@qualityinsights.org. And you can check out our other interviews by visiting qualityinsights.org/QIN_vlogs and pods. That's qualityinsights.org/QIN_VLOGSNPODS. Shirley, thank you for joining us.
Thank you for having me.
And thank all of you for joining us.